This recording is the muscular system, part 4 of 4. We're going to start our journey through muscles of the pelvic girdle and lower extremity with Gluteus Maximus, which is the prime mover in hip extension. You can see that the fibers of Gluteus Maximus are oriented diagonally, and Gluteus Maximus originates on the dorsal and medial surface of the ilium, as well as the sacrum and the coccyx. It inserts on the gluteal tuberosity of the femur and the iliotibial tract. We'll discuss the iliotibial tract in an upcoming slide. The action of Gluteus Maximus is extension and lateral rotation of the hip. Gluteus Maximus is the prime mover for hip extension. Gluteus medius is somewhat superior to and lateral to Gluteus Maximus. The starred area on the picture on the right is pointing to Gluteus medius. The muscle inferior is Gluteus Maximus. Gluteus medius originates on the lateral surface of the ilium and inserts on the greater trochanter of the femur. Its action is abduction and medial rotation of the thigh at the hip, because remember, all motion takes place at joints. It can help stabilize the pelvis when standing on one leg and is essential for runners as they extend their legs and are basically swinging through one leg at a time during a running gait. The next muscle is Gluteus minimus. If you look at the picture on the left, you'll see that Gluteus Maximus is here and has been cut. This muscle is Gluteus medius, and just deep to Gluteus medius is Gluteus minimus. Gluteus minimus has the exact same action as Gluteus medius. They both abduct and medially rotate the hip. Gluteus minimus has its origin on the external posterior lateral surface of the ilium, and the insertion is on the greater trochanter of the femur. I mentioned earlier that I would talk about the iliotibial tract. The iliotibial tract is a band of connective tissue that extends from the ilium all the way down past the knee to the tibia. The iliotibial tract has embedded within it a muscle known as the tensor fascia lata. Tensor fascia lata is this muscle here. On this picture on the left, they've extended the iliotibial tract as a red line that goes down towards the tibia. However, the picture on the right of the model is actually more accurate. Tensor fascia lata is singular. If we wanted to include both sides of the body, we would say tensor fasciae latae, adding an E to both the word fascia and lata. The origin of this muscle is the iliac crest and anterior superior iliac spine. The insertion is the iliotibial tract. Sometimes you may hear the iliotibial tract as being referred to as the iliotibial or IT band. The tensor fascia lata muscle acts to help fix the knee joint and stabilize it. It also flexes and abducts the thigh at the hip and assists in raising the knee and abducting the thigh at the hip. The most important action that the tensor fascia lata muscle has, though, is to help stabilize the knee joint in walking. The piriformis muscle is a muscle that is deep to gluteus maximus and gluteus medius. Here on the right side, where we have our picture of our deeper muscles, we can see gluteus minimus, which is deep to gluteus medius, and we also see the piriformis muscle. The piriformis muscle acts to abduct and laterally rotate the hip. It originates at the anterior lateral surface of the sacrum and inserts in the greater trochanter of the femur. Sometimes the sciatic nerve can get kind of pinched underneath the piriformis muscle if the piriformis muscle is too tight, and that is referred to as piriformis syndrome. It's not as common as people think it is. Usually piriformis syndrome may be misdiagnosed due to other things that are going on with the musculature that is acting in concert for hip motion. This takes us to a muscle group that is collectively known as Iliopsoas. Iliopsoas is a muscle group that includes the psoas major muscle and iliacus. Iliacus originates in the iliac fossa of the ilium and inserts on the lesser trochanter of the femur. The psoas major muscle, which is the filet mignon of a cow, for anyone who eats steak, originates on either the transverse processes or vertebral bodies from L1 to L5. Books go back and forth as to whether it's transverse processes or vertebral bodies, so that doesn't matter to me one way or the other. Not all books say T12, some do. Most of them say it originates from L1 to L5. This muscle group is a prime mover for hip flexion. And if the spine is fixed, the muscle action is hip flexion. If the pelvis is fixed, then this muscle group can cause flexion of the lumbar spine. So this is one of those instances where the origins and insertions can change depending on what part of the muscular attachment is fixed and what part is movable. Remember, I don't really need you to know every single origin and insertion. You should know the difference between an origin and an insertion, a synergist and a fixator, and you should also know origins or insertions when that particular structure is included in a name. I've already given you sternocleidomastoid as an example and coracobrachialis as an example. So these are just times where you should be able to figure that out just by the name of the muscle. Sartorius is the longest muscle in the human body. It originates at the anterior superior iliac spine and inserts all the way down on the medial aspect of the proximal tibia. The sartorius muscle is sometimes referred to as the tailor's muscle because years ago when men would go to a fine store to get pants, they would have the cuffs tailored to make sure that the hem of the pant or the cuff was at the right place. And a tailor was a man who would sew the pants at the right length, and he would often sit on the ground with his legs crossed. So if we look at the action, it includes hip flexion, lateral rotation, and knee flexion. So we have three things going on. We have flexion of the hip, flexion of the knee, and lateral rotation of the hip. This is what allows you to cross your leg. Hip flexion, knee flexion, lateral rotation of the hip. We have groups of muscles that help to adduct the hip, and this includes Adductor magnus, which we can also see here, Adductor longus, and Adductor brevis. Adductor magnus originates on the pubis as well as on the ischial tuberosity. Adductor longus and brevis both originate on the pubis, and the insertion for Adductor magnus and longus and brevis is the linea aspera for all three. These muscles all flex, adduct, and medially rotate the hip. I refer to these muscles, to help me remember what they do, as FAM muscles, which stands for flexion, adduction, and medial rotation. Just like my EAM muscles for latissimus dorsi and teres major were extension, adduction, and medial rotation, my FAM muscles are flexion, adduction, and medial rotation. So the A is always adduction, ADD, adding towards the midline. Other adductors include pectineus, which originates on the pubis and inserts on the femur just distal to the lesser trochanter. Pectineus is also a FAM muscle. It will also flex, adduct, and medially rotate the hip. There is another adductor called gracilis. Gracilis originates on the pubis, but inserts on the proximal medial aspect of the tibia. Therefore, because it crosses the knee joint, it flexes the knee and adducts and medially rotates the hip. So it's not a FAM muscle because instead of flexing the hip, this flexes the knee. That's a really important distinction for gracilis. Even though it is an adductor and it adducts and medially rotates the hip, it flexes the knee. On the anterior aspect of the femur, we have 4 muscles that make up the Quadriceps femoris muscle group. Femoris meaning femur. Rectus femoris goes straight down and is the most superficial of the Quadriceps femoris muscle group. Its origin is at the anterior inferior iliac spine as well as the top of the acetabulum. The insertion is the tibial tuberosity, as all of these muscles have connective tissue that blends to become the patellar tendon, and then as the patella is embedded in the patellar tendon between the patella and the tibial tuberosity, technically some books call that the patellar ligament that goes to the tibial tuberosity. The action of all of these 4 muscles is knee extension. Here we have rectus femoris, straight down the anterior portion of the femur. On the lateral aspect, we have vastus lateralis. The origin of vastus lateralis is the greater trochanter and the linea aspera. The insertion is the tibial tuberosity by way of the patella. The action, again, knee extension. All four quadriceps femoris muscles extend the knee. We have vastus lateralis on the lateral aspect of the thigh. We have vastus medialis on the medial aspect of the thigh. Vastus medialis has its origin on the linea aspera and the intertrochanteric line of the femur and inserts on the tibial tuberosity by way of the patella through the patellar tendon and patellar ligament. Its action is knee extension. If we look medially to laterally, we have vastus medialis, rectus femoris, and vastus lateralis. Deep to rectus femoris is vastus intermedius. We can see vastus intermedius here, where that red arrow is pointing. Vastus intermedius originates on the proximal shaft of the femur and inserts on the tibial tuberosity, again by way of the patellar tendon, which becomes the patellar ligament, and acts in knee extension. Next, we're going to discuss the hamstrings. All hamstrings are knee flexors. They're also actually hip extensors. Depending on which side they're located, they will either laterally rotate the hip if they're located on the lateral aspect of the posterior portion of the thigh, or medially rotate the hip if they're located on the medial aspect of the thigh. First, we're going to look at biceps femoris, which has two heads. One origin is on the ischial tuberosity, while the other is on the linea aspera of the femur. The insertion for biceps femoris is the head of the fibula and lateral condyle of the tibia. Again, the action for biceps femoris is knee flexion. It will also extend the hip, and because biceps femoris is more laterally oriented than the other two hamstrings, it will laterally rotate the hip. By the way, the hamstrings get their name because traditionally butchers would string hams by the tendons of these muscles. I'm going to point out the next two hamstrings that we're going to discuss. One is deep to the other, and these are both located on the medial aspect of the thigh posteriorly. Semimembranosus is deep to semitendinosus. Here on the far right picture, we see semitendinosus on top and semimembranosus deep to it. Remember, semitendinosus has the letter T in it. The T goes on top. Semitendinosus is pictured here on this mannequin on the right here. Semitendinosus has its origin on the ischial tuberosity and inserts on the proximal shaft of the tibia. The action for semitendinosus is knee flexion because all hamstrings are knee flexors, hip extension because all hamstrings do extend the hip, and because this is oriented medially, it will cause medial rotation of the hip. Semimembranosus, we know, is deep to semitendinosus. If we look at this model, We have biceps femoris laterally, semitendinosus on top, and peeking down below on either side of semitendinosus, we have semimembranosus deep to semitendinosus. Semimembranosus because it has its location on the medial aspect of the hip. Being a hamstring will flex the knee, extend the hip, and medially rotate the hip. Its origin is on the ischial tuberosity of the coxal bone and inserts on the medial condyle of the tibia. This takes us to Tibialis anterior, which has its origins on the lateral condyle of the tibia, as well as the proximal tibial shaft and the interosseous membrane found between the tibia and the fibula. It inserts on the medial cuneiform as well as the first metatarsal and will act to dorsiflect the ankle and invert the foot at the ankle. So it causes dorsiflexion and inversion of the foot at the ankle. Extensor hallucis longus originates on the shaft of the fibula and on the interosseous membrane between the fibula and the tibia. It inserts on the distal phalanx of the first digit of the foot and acts to dorsiflex and extend the big toe. Extensor digitorum longus is marked by a question mark on this slide, and as you follow the tendon for extensor digitorum longus, you'll notice that the tendon branches out to extend toes 2 through 5. So the origin is the lateral condyle of the tibia and the proximal fibula, as well as the interosseous membrane between the tibia and the fibula, and it inserts on the middle and distal phalanges of digits 2 through 5 to dorsiflex and extend toes 2 through 5. This takes us to the lateral aspect of the leg, where we see fibularis or peroneus longus and brevis. This arrow is pointing to fibularis longus, or if you said peroneus longus, that is also correct. I'm going to point out fibularis or peroneus brevis while we're here on this picture because it's a good picture. Fibularis longus has its origin on the lateral aspect of the fibula and inserts on the first metatarsal as well as on the medial cuneiform and acts to plantar flex and evert the foot. Here we have a clearer picture of fibularis or peroneus brevis, which originates on the distal shaft of the fibula and inserts on the 5th metatarsal. The action of fibularis brevis is also to plantar flex and evert the foot at the ankle. Flexor digitorum longus originates on the posterior aspect of the tibia and inserts on the distal phalanges of the 2nd through 5th digits in the foot and has the action of plantar flexion, inversion, and toe flexion. It helps people get a grip with their toes. When I was younger, did not keep my bedroom very well, and sometimes I would be motivated to clean it up due to parental supervision and insistence, and I would often walk around my room picking things up with my toes and bringing my feet up to my hands to grab whatever was laying on the floor. Here we have some pictures of flexor hallucis longus, which originates on the shaft of the fibula and the interosseous membrane and inserts on the distal phalanx of the big toe, which you remember is hallux. The action of flexor hallucis longus is plantar flexion and flexion of the big toe. This takes us to tibialis posterior, which is on the proximal aspect of the tibia and the fibula and inserts on the tarsals as well as metatarsals 2 through 4 with the action of plantar flexion of the foot at the ankle. Gastrocnemius is a muscle that is noticeable on the posterior aspect of the leg. Gastro means belly. There are two muscle bellies. The medial portion of gastrocnemius originates on the medial condyle of the femur, and the lateral portion of gastrocnemius, the lateral belly, will insert on the lateral condyle of the femur. Because these are originating on the femur, gastrocnemius can flex the knee as well as cause plantar flexion of the foot at the ankle. The insertion of gastrocnemius is by way of the Achilles tendon, which attaches this muscle to the calcaneus. Again, the actions of gastrocnemius are flexion of the knee and plantar flexion of the foot at the ankle. The soleus muscle lies deep to gastrocnemius. There's soleus in the middle, and here's gastrocnemius superficial to it. Unlike gastrocnemius, soleus does not cross the knee. Therefore, soleus, which has its origin at the proximal tibia and fibula and interosseous membrane and insertion on the calcaneus by way of the Achilles tendon, can only plantar flex the foot at the ankle. And those are the muscles.